Administering an intramuscular injection. An intramuscular injection is a method of injection that is injected into the muscle of an animal, and the purpose of this is to place a substance deeper into the animal through a muscle. Common sites on small animals are in the quadriceps or hamstring muscles, as well as the Apaxial muscles. A veterinary assistant, a veterinary technician, or a veterinarian in the vet clinic can administer an intramuscular injection. Note some of the proper sites for administration for an intramuscular medication. Step 1 is to select the proper site for administration. Step 2, direct the needle through the skin and into the muscle. Notice that this is at a 90-degree angle. Step 3, aspirate. If no blood is noted, inject. Aspirate means to pull back on the plunger slightly to make certain you are not in a blood vessel. If you are, blood will enter the syringe at that time. This will prevent accidentally injecting medication into the bloodstream that does not belong. Step 4, withdraw the needle and place it in the sharps container. Step 5, massage the area where the injection was given and praise the patient.
Hi, my name is Courtney Jones. I'm a registered veterinary technician, and today I will be properly demonstrating how to administer an IM or intramuscular injection. The IM injection is exactly how it sounds. It is an injection that we give in the muscle. And depending on where we give this IM injection will depend on the max amount of volume that we can actually inject. For example, on a dog this size, kind of medium-sized dog, if we're working with the deltoid or the thigh muscles, we can only inject about a max of 2 mils. However, if we're working on the back on the Apaxial muscles, we can inject up to 5 mils. And that amount is just going to increase as the size of the animal increases. To start, I'm going to select the proper site for administration. There are 3 very common sites to administer IM injections in dogs and cats. The deltoid muscle that runs along the humerus shoulder right here, the thigh muscles on either side of their legs, or the Apaxial muscles which run on the lower back. Once I have my proper site for administration, I'll be working with the Apaxial muscles right here. I'm going to direct the needle through the skin into the muscle and give that injection. When I give the injection in the Apaxial muscles, I want to make sure I make a piece or V with my fingers, and I want to place my middle finger over the spine so I don't make sure I don't hit the spine. And then as far as my fingers can make a V, I will place on the back. And this right here is where I can give that injection in the muscle. So I will take my needle and direct it through the skin into the muscle, aspirate to ensure I'm not in a blood vessel, and give that injection once I have noted there is no blood. I will then place my needle into the sharps container and rub the injection site and praise my patient. Good boy, Manny. I'm going to properly demonstrate how to give an intramuscular injection. To start, I'm going to select the proper site for administration. I will be working on the Apaxial muscles that line the back right here. I'm going to direct my needle through the skin into the muscle and aspirate. If I note no blood, I'm going to inject. I'm going to withdraw the needle and place it in my sharps container and rub the injection site and praise my patient. Good boy, Manny.
In summary, to administer an intramuscular injection, you will select the proper site for administration, direct the needle through the skin and into the muscle, aspirate. If no blood is noted, inject, withdraw the needle and place it in the sharps container, and massage the area where the injection was given and praise the patient.